The whole process of it was really emotional and traumatic for my family.
Lisa is a Twin Cities down-to-earth, stay-at-home mom. She homeschools 3 of her 4 children. Her youngest child has special needs and requires constant therapy and medical care. Lisa's husband Blair says she's the backbone of their family, but nothing prepared them for the medical drama that they suddenly faced in the spring of 2003. It started when her doctor found a lump in her breast.
Each step of the way, I was surprised a little bit because I've never, you just don't expect them to say, now we need to do the next thing. So he said there was some microcalcification and we should do a biopsy.
Her biopsy was done at St. John's Hospital and taken across town to the Healthiest Lab at St. Joseph's Hospital. When her biopsy came back, the results even surprised her doctor.
He came back from the lab and said, I'm sorry, it's nothing I expected. It's ductal carcinoma in situ.
I drove over there and walked in, and I could see that something was definitely not as expected. Cooper was crying. There were people trying to help with Cooper, and Lisa was crying as well, and it was shocking. They told us the news, and a lot of what happened after that was that day is a blur.
It was pretty traumatic that day.
Like any family facing cancer, they spent the next agonizing days trying to figure out what she should do. They had tough decisions to make, and once they did, how would they know they made the right ones?
I really was against radiation and chemo, anything, and Blair was more wanting to make sure we got it. I remember sitting in Marshall's parking lot with my book, crying before I went to any of these appointments because I just didn't know what was the best choice.
I remember driving down 61 and heading onto the on-ramp to 694, and I opened my windows up and just screamed as loud as I could for as long as I could hold my breath. I just wanted to wake myself up. It was a bad dream, and it was just a difficult time. The whole scenario was a difficult time.
Their oldest daughter, Madeline, had nightmares every night during this period.
So I would think about what happened if my mom died, and I would have nightmares at night that she would die, and I would wake up and I wouldn't know she was going to be there. So I would have to walk into my mom's room to make sure she was there. And sometimes I would just stand over her and watch her sleep to make sure she was still breathing.
It was after Lisa's lumpectomy, a pathologist discovered an error had occurred in Lisa's biopsy lab work. A lab technician had accidentally mixed up her healthy tissue with another woman's cancerous tissue.
It turns out both of these came from St. John's. They were both breast biopsies done back-to-back, sent down here, and were processed back-to-back. And through the lab process, somehow got mixed up with each other and reported out. There had already been several weeks of time from the mammogram and the biopsy, and then on May 29th, what she had, the unnecessary procedure she had, was a lumpectomy. So May 29th was her lumpectomy to remove this so-called cancerous lesion. That was a procedure she didn't need to have.
And then once we had the facts and we knew a little bit more about what actually happened, we wanted to make sure that we fully disclosed to both patients.
Perhaps I think the biggest and hardest part was just acknowledging to Lisa that we made a mistake, and her family that we made a mistake.
It was a hard conversation to have because I felt bad for, the news we had to give her. But it was most important that we, be truthful.
And I remember Laura talking to me the whole time and Dr. Moravec talking to my children, and it was as if I was in almost a tunnel where things were going by me and I couldn't hear or see because it was just surreal.
I thought of her mom. I thought, I'm sure her mom is scared. I'm sure her kids are scared. I'm sure her husband is scared. And all this that she went through, it was just, how do you make that right?
People are human. There's going to be mistakes. I just think it was a better thing to know that I was being told what happened. And even on the other side, for the other person whose tissue was the opposite, I think about her all the time. I
was more of a skeptic than Lisa. I was, are you sure? How do they know? What kind of evidence are they giving you? Have they told you what happened? How can we be sure that this is truly you're the one without cancer?
What we ended up doing with her was to send a sample of her blood and the tissue specimen to Mayo Clinic for a reconfirmation of the biopsy findings and also for DNA testing. We wanted to make sure that the specimen fit with Lisa's DNA. And so that confirmed that that specimen was correct and that it was not cancerous.
That was the best part of it, to know that it was just gone.
It was important for Lisa to know what had happened, how it happened, and know that the hospital was doing everything it could to prevent it from happening to another patient.
I think because you hear many times that if a mistake is made, it's hidden, or they don't want to tell you, or they only tell you what they think you need to know, kinds of things. I was really clear and adamant to Laura Kaitan that part of what I wanted from the whole experience was to know step by step what had happened and where the error had occurred and what was being done so that it wouldn't happen again, and feeling like I needed to just know the truth.
So how do you undo a surgery that was done, and there isn't a good way to do it. It really, I think, is about honesty and sincerity, and I think it's around an ongoing conversation that starts to heal that, that error and that insult is what it is.
A root cause analysis discovered what caused the problem. New safeguards were immediately put into place, including never allowing the same type of tissue to be processed back to back, and to make sure only one tissue is processed at a time.
Probably one of the hardest things to fix is human error, is human lack of attention or lack of following a process, because that's dependent upon people just doing their job and being attentive to the work around them.
I didn't want her medical record or the insurance company anywhere to think that this person had cancer, because it could affect her coverage, it could affect her down the road. What if even 10, 20 years down the road they pulled the medical record and it says that she has cancer and she didn't? So really took the due diligence of making sure that we did a corrected report, that we sent notified all the doctors.
One of the things that I hope comes out of this is that there's a great appreciation for how careful we have to be on every single step of the way in healthcare. And the second thing is, when an error does happen, that we have to take great pains to correct that as far and as wide as possible, even to the point of going beyond the patient, to look at the family and maybe the network of friends or support systems that they have to try to correct that.
When they're tired, when they think about processes, ways to take shortcuts. Again, this is an experience that you can only understand, I believe, if you've experienced it yourself. Think of the people that you've affected. Make the extra effort, please, to follow the proper procedures and not to take shortcuts, so that people won't be affected in a negative way.
What I've found is that open and full disclosure and honesty around and sincerity around this error. It's not really that hard to do, but you have to be willing to stick through it for the entire course. This isn't just having the one conversation and then being done with it. So Laura and I had multiple conversations with Lisa, and we continue to have conversations with her.
We are so thankful that I don't have cancer. It just was that it really, it turned our family upside down for a time, and it took a while to get back to what was our normal after that happened.
I can see when she looks in the mirror, sometimes it affects her, it disappoints her. She still thinks about that. And you know, some people may say, boy, you should really be excited that you don't have breast cancer and not worry about those things. And that's partially true, but it's still a daily reality that you look in the mirror every day and see part of you missing because of a mistake that could possibly have been prevented.
In general, healthcare is incredibly safe. And if you happen to be that one person injured by an adverse event, how injurious or harmful that can be beyond what we would normally see as providers of care. So, you know, the lab tech has an incredibly important job to do. The respiratory therapist, the nurse and physician, you know, the X-ray tech, all of us have a huge role to play in making sure that we have the right patient, the right procedure, and the right specimen. So, and when that doesn't happen, the result carries far beyond what we would normally expect.
Maybe the person in the lab that day was in a hurry and trying to get off work, so she decided to do two at once and not use the proper procedure. What I don't think what I know she didn't think about is how might that affect the person whose slide I'm doing that to.
I think in Lisa's mind, she was thinking, do they care? I know they care, but you know, part of this too, it's like, could we even make them make the connection even more? Because what they do every day makes a big difference. It's something I'll never forget. I'll never forget her name. I'll never forget. And I don't ever want to forget, because if it didn't matter to me as much as it did, I don't want to be a hospital administrator.
It makes a big difference how people treat you as a patient as to what kind of response or reaction you'll get. When I was treated with respect and kindness and compassion, I felt better cared for.
I'm convinced that the disclosure process for an adverse event such as this or any other adverse event really is the start of healing in a person or a family.